Hello everyone, I'm Dr. Tanya and today we'll be talking about fertility preservation. So, how to proceed for pregnancy after fertility preservation? So, it depends upon whether you have frozen your semen sample or you have frozen your oocytes or you have frozen your embryos. Now, if you have frozen for embryos, you can proceed for pregnancy whenever you want to conceive. You can go to your fertility specialist, you can ask them to transfer the embryos which have already been made and preserved in the lab inside your uterus. But if you have preserved your oocytes or you have preserved your sperms, once you get married, you can take the spouse's gametes, you can make the embryos, and then those embryos can be transferred inside the uterus to achieve the pregnancy. So many a times there comes a question, is there any added risk to the baby if we go for fertility preservation? So to answer that, there's no added risk to the babies after fertility preservation. So when we are going for IVF, the risk of having an anomalous baby is around 3 to 5%. It is the same for fertility preserved babies as well. So whether you preserve your eggs or sperms or embryos, there's no added risk apart from the risk which is already there in IVF. There's no added risk to the babies after going for fertility preservation. Technically, these gametes can be preserved for as long as you want, but legally that is not so. In India, legally you can preserve your gametes for up to 10 years. So you have to plan your pregnancy within those 10 years of preserving your oocytes, sperms or embryos. So many a times there comes a question, does egg freezing reduce the fertility? So to answer that, the answer is no. If you are freezing your eggs in the cycle, so whatever eggs were recruited during those cycle, only those eggs are forming and we are preserving those eggs. So in the next cycle, there would be recruitment of additional eggs and hence the fertility is not effective. Same goes with sperms. So if you preserve your sperms, then sperms keeps forming in our body. Preserving sperms at one point does not decrease the quantity or the quality of sperms thereafter. So to summarize it, if you are planning on preserving your eggs, sperms or your embryos, you should do it at an earlier stage, at an early age to have a maximum benefit out of it. So that will be all for today. To know more about fertility preservation, you can visit our website or you can directly call us at the given below number. Thank you.